Early Lives Equal Start project, which is a first of its kind for our community, has brought together women from diverse backgrounds to tell their stories using the public narrative framework or Stories for Change. The framework has 3 core elements: the story of self, the story of us, and the story of now. Their hope through this message is that you will hear the urgency and be a part of the change that will work to transform our community for social good.
Life in a foreign country is not without its fair share of challenges. I had no idea about the healthcare system in the UK.
At first I was a bit anxious because I was in a new environment and I was away from home. The professionalism, transparency, and care was amazing. Even though I ended up having an emergency cesarean section, this time I felt prepared.
I remember my midwife told me that she's gonna refer me to Rose Clinic. I didn't know what it that in the beginning until I went to the first appointment, and I meet Dr. Brenda Kelly. I shocked that she's very nice and she speak my language from the beginning. When she saw me and she says Salaam alaikum, and that make me a little bit, the nerves go away. The reason that I had appointment with her because the FGM, and she was explaining about the law in UK, and especially if I have a daughter.
My first experience in the UK wasn't easy at all because of the language barrier. When I saw my midwife, they gave me information about the birth plan, but I didn't understand what is written in there. In 2021, I was volunteer at Asylum Welcome as a Europa Welcome Advisor to help East Timor community who are struggling with the US application form to settle in the UK.
Ever since 2010, I help people with getting insurance number, NI application, GP application, and still other forms that I help with. And I also done paid work for Asylum Welcome and for Early Life Equal Start program.
I'm Mariam, a registered mental health nurse practicing at HMP Prisons and Probation Services.
I'm of Syrian descent. I was born here in Oxford at the John Ratcliffe. I am a birth doula and an antenatal meeting holder. My meetings are wonderful. The group is called Birth Space, where women can talk about birth positively, openly, in a warm and safe environment.
I enjoyed my pregnancy. I worked throughout, but it all changed from 40 weeks. I got ill, very unwell, sick throughout, diarrhea, everything was going upside down. But I feel I was not listened to because however much I tried to explain to them, I'm concerned about my life. I don't feel well, I'm not eating, I'm not drinking. But their concern was only the baby. I was told the baby's fine, go back home. So I did that for 2 weeks. Then I was told, when I came in, I was told I should wait until the bed gets available. This time it was a bit late, around 8 o'clock in the night, but still I was told nothing was going to be done in the night. When the multidisciplinary team came in at around 9:30, 10 o'clock, that's how everything changed, because as soon as they put me on the monitor, they realized something was wrong with the baby. So I was rushed into theater. I was told, oh, it's very emergency. You cannot wait for your family to come. You cannot wait for your partner to be here. I believe probably I would have been helped earlier, or they would have intervened earlier, but because they have to work around the trust policy, nothing could be done, which I believe put me at risk at that time.
So I'd like to share a story about H. She is a Syrian refugee. So during that time after birth, she was bleeding heavily. She wasn't able to hold or carry or feed her baby. And the GP said that she's probably got the flu or something, but she's progressively got worse and worse. Eventually they found out that she had still a part of her placenta retained nearly a month after the birth, and she was very lucky to have survived that.
I have seen in her different stories that families face. So one example was a woman who was sent back home from the hospital. She ended up giving birth in her car, before she reached her home. Can you imagine how difficult that situation would be for her?
I feel like these women need help and desperately come to us to help them, support them. One lady called A, she called me on New Year's Eve in the evening. I just finished cooking. I sat down in the living room and my phone rang, and she desperately wanted to talk to midwife and a doctor because she doesn't speak English. Her water was broke and she was in the hospital with her husband. I stay on the phone hours and hours to do some interpretation, like word from epidural to the word push, because she didn't understand what push means.
I was so lucky to have a very good midwife, kind and very friendly. However, my problem was I didn't visit the dentist while in a 6 months pregnancy, because I didn't know that I have a right to get a free dentist during pregnancy. So I assumed that NHS card could only use for prescription drugs.
Brexit has caused so many problems for our community. Some East Timorese mothers took the risk and come to UK without knowing what the immigration system is going to impact their life. People come to my house all the time. People ring me up for free interpretation. And even professional people, they call me anytime when they need my help. Sometimes I have to come with people to an emergency. The hospital that doesn't have enough interpreter.
There was a woman who came to us and she was unable to go for a dentist for a longer period of time, and we were unable to put her anywhere because they were not accepting anyone because of the waiting list. I think it is important to give moms, especially pregnant women, their support in a timely manner. Otherwise, this might lead to hopelessness or reluctance to seek further help. During my community work, I faced significant challenges in providing support for the families who need service. This left me sometimes frustrated and overwhelmed.
I had difficulty breastfeeding as well. They called me to go straight away to surgery. When I had cesarean, I had a pain. They told me to not carry anything heavy. But on that time, I don't have anyone help me, so I have to carry my baby coat from my first flat to get a taxi. In my country, can't speak our problems, for breast, we can't speak to the male. So when I got there, the male doctor asked me to pull up my t-shirt, and they checked me, but I was so shy.
I had very nice midwife who was supporting me all the time. With my experience, I can say I'm lucky. Maybe that's not happening to everyone. That's make me, I want to develop myself more to understand my right, to understand the law in the UK, to fight for my right and for my kids' right.
When my midwife came to visit me at home, she found me, I was crying a lot, and she gave me a paper to fill up. It's about mental health assessment. I fill up the paper, I gave back to her, and that time she didn't coming back to say anything.
S was born in the UK. She's very well spoken. She's of Pakistani descent and covers her hair and things. She had quite a traumatic first birth, so she really wanted her second to be different. But the midwife wouldn't talk to her in a caring, supportive, holding way. And I think that was extremely upsetting for her. But upon reflecting on her birth, she expressed that she did feel like it was a racial issue. But I'd also like to mention that there are many positive stories that I hear as well, and that's what we need more of.
I want to develop myself, and I want to know everything about the right of pregnant women. Maybe I will meet one woman that she needs help and I can really help her.
I would like to say thank you for the NHS for providing me such a wonderful service during my pregnancy and birth. My hope is that we in the Early Life Equal Start project can offer a real support and help to the families who need it most.
Right now, we need you to make this change for these women. Tetum translation needs to be available in digital and paper so they can understand what is written there, and then when they see the midwives and GP, they know what they are about. We need to train and employ East Team advocacy and community organizer to spread this information to help these women to be able to give a better solution.
The ESMA course, I feel very grateful because from this course I learn a lot about healthcare. I'm learning about the women voices and to support each other.
My call for action would be a mother needs to be listened to. If she feels she does not feel well in herself, I believe something needs to be done, not only to assess the baby, but also her life to be considered.
We need more health care like Brenda Kelly and the midwife, what they took time to listen to me and supporting me. We need more program like ESMA program. We need to give women more knowledge and English lessons so they can speak up and we can support them.
This is my advice to NHS. Please don't change midwife while they get to know each other. And when you give the injection, please explain to the women what this is for and help them. Give helps to cesarean mothers when they don't have anyone to help them at home. Follow up the mental health. Please, when they fill up the paper, please get back to them so they know what's going on.
I would say that we need to provide more resources to mothers with more complex needs in the community. We need more training for midwives and other staff on inclusion, equalities, unconscious bias and anti-racism. I see there could be solutions through greater partnership between the community and the healthcare systems to improve outcomes for mothers who are from a more disadvantaged background.
That we can provide real support and make a difference to everyone, every woman in quicker.
So can you please continue funding the ESMA program so then we can be able to help others more?
Giving birth and how we are treated has lifelong outcomes for both the mother and baby. Future generations rely on that very moment.